Hi everyone. In this lecture, I'd like to introduce the double tight, which is dual-length microblade RF to target the papillary and reticular dermis separately. And then we added the injection needles. So because we want to deliver the drug into the reticular dermis at the same time, so that we can get the synergistic effect of radio frequency and drug delivery as well. The double tight is a smart hybrid device for skin rejuvenation. It has dual-length microblade radiofrequency device and an injector functions. One more thing is the VVIP, which is vertically vibrating infusion pool for drug delivery system into the especially papillary dermis. The double tight has two different types of tip. The one is the RF tip plus injection needle tip. And the other thing is RF only tip. Injection depth of double tight is 1 millimeter. So the long needle of double tight is 1 millimeter. So it delivers radio frequency first and then inject the injectables. And double tight has very unique device because it has two different lengths of the tips. The short one is for the papillary dermis. The length of short pin is 0.4 millimeter and length of long pin for reticular dermis is 1 millimeter, so that it can deliver the radiofrequency energy into the papillary and reticular dermis separately at the same time. It is a very important thing. This is the experimental histologic picture. So as you can see, the left side long needle RF can make the change of the reticular dermis denaturation. The right side is changed by the short pin or radiofrequency pin of double tight. It shows denaturation of papillary dermis area. This is the actual movie file of treatment. As you can see in this video, it is stamping method. So 1 Hz. So if you stamp into the skin, it delivers radio frequency first and then inject the drugs by long needles. So far, many people thought the harder you shoot and the deeper the treatment can get the better result. But it's wrong. It's a wrong, scientifically wrong fact. Because the destruction versus regeneration is a different concept. If you want to destroy our target, for example, in agonist treatment, if we treat the acne, our target is sebaceous gland, we have to destroy the sebaceous gland. So we have to deliver enough energy to destroy the sebaceous gland. But for skin rejuvenation, it's not good to destroy the target, especially papillary fibroblast, or to deliver too high energy. Is not good for the skin rejuvenation. The proper energy for proper temperature is more important than higher or harder treatment in case of skin rejuvenation. This article shows direct exposure to mild heat stress stimulate cell viability and heat shock protein expression in primary culture broilers fibroblast. If we give mild heat stress to fibroblast, in short time, it can increase fibroblast viability. But if we give even if mild heat stress to fibroblasts with long-term exposure, it reduces fibroblast viability. So for skin rejuvenation or stimulate the papillary fibroblast, we have to deliver not too strong, not too high temperature to the papillary dermis area. The target temperature of double tide is 42 degrees in papillary dermis. By this heat stimulation, we can stimulate the papillary fibroblast. The VVIP, which is vertically vibrating infusion probe, can deliver the drugs from the skin surface into the dermis, especially papillary dermis. So, after injection into the drugs or medicines into the dermis, some injected material regurgitated out on the skin surface. At that time, we can use this VVIP, and which is only vertically vibrating. We can push the regurgitated drugs into the papillary dermis, and then papillary dermis can be more activated by drugs. This is the movie file of the effect of the VVIP. We applied the drugs on the gelatin block and made a hole with radiofrequency pin, and then apply the VVIP on the right side. As you can see, the right side, the VVIP applied side shows the infusion or diffusion of the drugs into the dermis, but not in left side. Applying the VVIP is very simple and it's just move slowly for 3 minutes by nurses or aestheticians. The patient can feel the comfortness and wellness sensation. In summary, the double tide treatment had 3 steps. The first step 1 is deliver the radiofrequency energy into the papillary and reticular dermis separately at the same time. And step 2 is injection by long needle into the reticular dermis. And step 3 is the drug delivery into the both papillary and reticular dermis by VVIP. From now, I'd like to introduce our recent clinical study, a split phase study. It is a proof of full thickness skin rejuvenation by double tide in real human aging skin. We designed the study in vivo with split phase study. So we treated the patient over than 65 years old on entire face except only left side of preauricular area, and then 1 month later those patients get the facelift surgery. So both left and right preauricular area was excised. And then we can compare the histologic changes of the left and right side skin. So this is the result. Upper picture is the untreated side, left side, and lower picture is treated side. They are 4 weeks later of histology. We can see the treated side shows more dense dermis, has more dense dermis. Let's look at closely. So we compare the collagen changes, the untreated area and treated area. So A and B is untreated side. It shows typical aging skin. The collagen fibers are fragmented and irregularly arranged. But the C and D, the treated side, shows thicker collagen bundles and very regularly horizontally arranged collagen bundles. And we measured mRNA expression of type 3 and type 1 collagen. As you can see, both type 1 and 3 collagen increases at the treated side, which means the skin, aging skin, changes to young skin in treated side. This is the picture of elastic fiber staining. So upper part, untreated side, shows typical aging skin. there is no thin, vertically arranged elastic fibers in the papillary dermis. And in reticular dermis, the elastic fibers are clamped and then fragmented. But the lower part, the treated area, shows new vertically arranged collagen elastic fibers. It is a sign of young papillary dermis. And the right side of the lower part shows the reticular elastic fibers. It arranged very well with collagen bundles. We can see the distinct differences between the untreated old skin A and B and C and treated skin D and E and F. As you can see, the treated side shows more layers of epidermis and more convoluted the papillary pattern of dermo-epidermal junction. We measured the layers and thickness of epidermis and convolution indexes. Every index shows the treated side shows characteristics of the young skin. This is a special staining for a marker of senescent cells, P16. The left side, untreated side, shows many brown spots, which is the senescent cell markers. But the treated side, right side, shows almost no brown spot, so almost no P16, which means there are almost no senescent cells after treatment. So from epidermis and papillary dermis and reticular dermis and collagen and elastic fibers and dermo-epidermal junction, every component of skin aging shows reversed change. This evidence of full thickness skin rejuvenation can be said reverse skin aging. The double tight can rejuvenate all layers of skin from epidermis to papillary and reticular dermis, which means full thickness skin rejuvenation and reverse skin aging. One of unique technology of double tight is we use not cylindrical traditional needle but polygonal microblade. So I'd like to explain why we used polygonal microblade instead traditional needles. This polygonal microblade, which is patent pending technology, uses multiple edge effects. If you see the upper part of left picture, the traditional cylindrical needle has only sharp area on the acral part or the tip of the needle. But the radio frequency has tendency to concentrate it or focus on the tip of the or edge. So it makes the concentration of the RF energy only in the just beneath in the around of the needle tip. In the other hand, double tight has polygonal microblade, which has a hexagonal cross section of the pin. So that has 6 edges on the surface of the microblade. So it can distribute the radio frequency energy more evenly than traditional cylindrical needles. This is actual thermal image and tissue reaction. As you can see, cylindrical needle makes heat on the tip, mainly tip of the needle. But in microblade, as you can see, the heat distribution is more evenly in the tissue. And I think you see kind of these pictures of heat distribution by multi-needle RF or needle RF devices. But actually this is not real. The real heat distribution is this. Double tight or agnes we use because we use polygonal microblade the heat distribution is more evenly distributed surrounded the pins, which makes precise targeting the layer. From now, I will share our clinical cases. So this is the picture 10 days later, the double tight. We treated only right side, but not treated left side. The right side has the skin texture is more smooth and more shiny. And we published it with the prototype of double tight. The evaluation of efficacy and safety of RF hydroinjector device for skin around the eye areas. In this clinical study, we got the improvement, not only wrinkles, but also skin roughness and pores. As you can see, especially improvement of pores is more dramatic than the other skin aging symptoms. This is a clinical case from Dr. Suyeon Becker-Weiman. She treated her twice. So as you can see, after one single treatment, her face shows many changes. More brighter than before, and her redness and her wrinkles and skin texture and pores, every component of skin aging symptom were improved very much. This is clinical case of our case. We treated her with every 4 weeks interval at 3 times. So her wrinkles, her pores, her redness shows many improvement before compared to the before treatment. This man was treated only 1 time. This is 4 weeks later, the treatment. As you can see, before and after, his face became brighter than before, and not only the brightness, but also his face shows more tight face. And let's look at closely his face of the skin. So his pore on the cheek is dramatically improved. This is another case treated 2 times. So with every 4 weeks, as you can see, his pigmentation melasma is improved and his pore is very much improved. Yeah, I will explain why the pore is very effective by double tight treatment, because the widened area of pore is mainly infundibulum area. From the sebaceous gland, the sebum secretion is alongside the infundibulum. So by excess amount production of sebum or aging process, this infundibulum become wide. The short microblade pin of double tight is 0.4 millimeter. It is fit to infundibulum area. So that's why with by only 1 or 2 treatment, we can get the pore or tightening effect even if with low temperature. One more interesting and dramatic change is the neck wrinkles, especially aging neck wrinkles, fine wrinkles, and aging changes. This lady shows a dramatic improvement of neck wrinkles after just 1 treatment. This is 4 weeks later. And profile view, you can see more smooth and tightened neck area. This case also provided by Dr. Suyeon Becker-Weiman. As you can see, she had many wrinkles before treatment, but by only 1 single treatment, as you can see, 4 weeks later, shows dramatic improvement. This is another case of neck treatment. This patient shows a typical photoaging skin of the neck, the poikiloderma, telangiectasia, fine wrinkles, and roughness. But after double tight treatment, she had a beautifully smooth textured neck. This is another case of the neck tightening. This lady, the 50 years old, after 3 times of treatment with every 4 weeks interval, she had more tightened neck. And from this, I will show you the long-term follow-up case more than 1 year. This lady treated for 1 year and 6 times. And as you can see, her pores and her skin colors and fine wrinkles is improved. This lady treated 5 times. As you can see, her skin color become more bright and homogeneous, and her pores and fine wrinkles are also improved as well. This lady, 48 years old, she treated 3 times. The right side is 1 year later after 3 times of treatment. So even she got the age, her face shows more tighter and brighter and less wrinkled. So what does it get better by double tight treatment? So I can say, because double tight makes full thickness skin rejuvenation from epidermis to bottom of the dermis, so it can improve all symptoms of skin aging. For example, wrinkles, loose skin textures, uneven skin tones, pores, and even if dyspigmentations. So in conclusion, the double tight is a smart hybrid device for full thickness skin rejuvenation. So it is real 3D-dimensional radio frequency, and the hybrid, which means radio frequency device plus injection device. And furthermore, it has a VVIP handpiece which can deliver the drugs from the skin surface into the papillary dermis by vertically vibrating probe. This is the world's first proven reverse skin aging device. Thank you very much for listening.